also we go over other vaccines that are out there. For example, every year in the US, you are required to take what? Flu vaccine. And then we take that without hesitance, because we don't want to get the flu. So the same thing with the COVID-19 vaccine, so it's highly recommended that we take it so that we are protected and be safe. So my word would be safe. What will make you safe? What do you think? So when you drive your car, you put on a seatbelt, right? Because you feel that the seatbelt will make you safe. So the same thing right now, safety, safety, safety. What is it that will make you safe? So if vaccine will make you safe, then you want to go for it. Thank you.
Excellent. Safety, making it, putting the people who are supposed to get involved, making them realize that it's for their own benefit. That's really, really important. Amisa, what do you have to say to that?
I think for that question, the way we approach it is actually like be factual, because sometimes people, when it comes to vaccination, you see that people are not rational, they go with a lot of emotional. So depending with the people that you're working with, you see, is it really, need to be factual, like state the fact, this is what is happening. So whether you like to accept it or not, COVID-19 is here, people are dying from it. And if you are not going to take the initiative to take vaccine, I'm sorry to tell you so, but it's not like we are special. So if you don't take care of yourself, something is going to happen. So depending, there's some people who actually understand, and you have to use different tones with them, make them understand where they're coming from. But for the people who are actually ignorant and resistant, you just have to be factual and let them know, okay, this is happening and it is for your own good at the end of the day. And we love you, we want to protect you, and that is why we're insisting for you to take the vaccine. So yeah, that's it.
Oh, thank you so much. Actually, we do have a question in the chat, Dr. Grace. If you can take a look, the question says that this has been, that as your role, is your perspective on COVID-19 vaccine influenced by having been at the front line of the first wave of COVID-19? What recommendations do you have for other nurses and other staff working in nursing homes?
Right. As a frontline head worker, my hospital, which is about 625 bed hospital, we are the epicenter. Before the COVID, actually our first patient was on March 10th, 2020. And within a month, my hospital of 625 bed became 100% COVID hospital. And so you could see, and sometimes I have post-traumatic syndrome right now, when you look back to see how people were dying from that COVID between March and April, the hospital was full with patients, COVID patients, and they were dying. So that really affected my perception, my belief, and right now the passion I have to make people to get the vaccine so they won't die. So if you look at the timeline between that March and April, the hospital became 100%. We had to create critical care unit from 3 units that we usually have to about 12 units to put patients in that were critically ill. And so when the patients, if you look at the lockdown, those public health measures worked from June, July, August, when people had to stay home. You can see that the hospitalization rate and death rate decreased right there. So those measures of social distancing and wearing masks really worked, and the city was shut down. But the city can't shut down forever. So by November, when people started coming out during celebration, you can see also the number went up. And then by December 2020 and January 2021, when the vaccine came out, that really helped again. As the virus, was moving around in the community with the vaccine, I could see from experience, my indicator when I look at what is happening with this virus during this pandemic is what I see in my hospital, my facility. Even right now, as we speak, since throughout this summertime, we have low number of COVID patients. But last week, we're beginning to see the number goes up. So I usually use these indicators, the number, what I see in the hospital, to reach out to my community. Yesterday, I posted online telling my community, if you've not taken your booster dose, you need to take it. Because during this period of family gathering, the virus is right there. Remember, if you have few people vaccinated, few, then the virus is going to spread. But if you have more people vaccinated, then there will be decrease in that spread of transmission. So I have seen from the past 18 months, this is not reading in the book or something, but real experience of how this virus is moving around in the community based on admissions and based on the patient that comes to the hospital. So right now we are seeing increase. Yesterday alone, I saw about 7 patients in the emergency room that are positive for COVID compared to the last month where there was 0 patient in the emergency room. So we are beginning to see that. And that correlates with what the science is saying, that if you take your vaccine 6 months after, you start to see the immunity or start to decrease. So now we are encouraging. I've just put out an email to all the nurses, please, and in the community, please go back for your booster dose. And if you've not taken your vaccine, you have to take it, because it was just too much death, too many people dying. When you see that firsthand experience, my goodness, it's very scary, for people to die. And this is why I'm out there in the community letting people know vaccine, is an alternative to lockdown. We don't want to lock down again. But since we have the vaccine, that will help us so we cannot come out. But the more people get vaccinated, that will give us time for community health immunity. And so we are hoping to enjoy this Christmas season, that we want people to get vaccinated. Thank you.
Thank you. You are certainly one of our healthcare heroes, those of you working in the front lines, and thank you for sharing that experience and being able to advocate for other people, having had those experiences. I do have one question for you, Amisa, from the chat. It's from Bethlehem. It says that I wanted to know what initiatives the community representatives had in place to increase vaccine confidence, which easily can be mistaken for vaccine hesitancy.
Right, and that is what we're saying. The vaccine.
Sorry, Dr. Grace, I wanted to direct that to Dr. Amisa.
Okay.
Ms. Amisa. Too many doctors. Go ahead, Amisa.
So what we did actually to combat that was actually using community radio stations, which I usually run. So I usually run community radio station every Saturday, and just using the local language, local human, local, like everything locally, so that people can understand COVID-19, passing more information about it, prevention measures, all those things. So using tools like the community radio stations, where people actually, it is easy because you find that people who are working, people who are driving to work, or people who are just doing local work can be able to tune in and listen to. So that was the first way, using community registration, or partnering with faith-based organizations, whereby we found that working with them, nurses, doctors, like every individual who have a role at the community and who is most listened to, we tried to work with them, because we know, let's say for community, for faith-based leaders, religious leaders, it was easy for people to listen to them. So working with them and ensuring that they have the right information, and then them relaying the same information to the people who listen to them, was another way of going through it. And then another way of going through it that had been introduced was coming up with animation, comic books for kids who are at school levels, who could engage with and just learn from COVID, what COVID-19 is, how you can take care of yourself, like using those kind of tools to make sure that people, like kids, youth, are able to understand it, the animation, like related to it, and just being able to practice. So those are the things that at the community level was done. And since the barazas, where people come together, was not able to be done because of social distancing and everything, so it was easy to find places whereby for field open spaces, and then training them, having the conversation over a microphone, and then releasing people to go and share those information to other people at the grassroots level. So those are the things that we did at the community level to make sure that more information is passed and there is prevention measures taken.
Oh, thank you so much for that. That's really, really useful information from the ground in Africa itself. And I really want to say it's wonderful that the organizers, Repker, and Dr. Ekbe, how you put this together to have both perspective in the United States and also on the ground. One thing that I've seen in the comments of Pastor Adioye is the idea of collaboration. And I think that you already addressed some of that with, saying that you want to work with religious leaders on the other side. I would like to round up, but I would like to give one chance for the Imam to also reach out and say a word about, how can you also work with community organizers like Dr. Grace and Amisa?
I really, from my observation, I cannot imagine that I'm falling short in any of my efforts, or